541. An adolescent with a juvenile diabetes mellitus develops failure. Which of the following diets is suitable? A. Low fat. B. Low mineral. C. Low protein. D. Low carbohydrate. The answer is C. Low protein. 542. A 60-year-old patient was admitted with hepatic coma in the intensive care unit. The physician has ordered protein restriction diet for the patient. Which of the following substances is most likely causes harmful effects when the patient increases protein intake? A. Urea. B. Creatinine. C. Ammonia. D. Amino acid. The answer is C. Ammonia. 543. A 40-year-old woman patient with Parkinsonism Medical Ward. The patient stated that she had symptoms for 2 weeks. The nurse was planning which type of diet is most suitable for Parkinson's patient. A. Solid. B. Liquid. C. Semi-solid. D. Clear liquid. The answer is C. Semi-solid. 544. A 68-year-old patient was admitted to the emergency room with clinical manifestations of pulmonary embolism. Arterial blood gas, ABG, and chest X-ray were ordered. Which of the following tests is used to diagnose this condition? A. Computed tomography scan, CT scan. B. Magnetic resonance imaging, MRI. C. Pulmonary angiography. D. A pulmonary function test. 544. A 68-year-old patient was admitted to the emergency room with clinical manifestations of pulmonary embolism. Arterial blood gas, ABG, and chest X-ray were ordered. Which of the following tests is used to diagnose this condition? A. Computed tomography scan, CT scan. B. Magnetic resonance imaging, MRI. C. Pulmonary angiography. D. A pulmonary function test. The answer is C. Pulmonary angiography. 545. 39. A 23-year-old woman presents to the clinic with an intense headache that rates at a level 8 on the 1 to 10 scale. Additionally, she feels nauseous and sensitive when exposed to bright light. Cerebrospinal fluid samples were sent to the laboratory for analysis and complete blood count. Testing both Kernig's and Brzezinski's signs are positive. The patient is admitted to the hospital and 1 hour later she has a seizure. In the period immediately following the seizure, the nurse stays at the bedside to provide ongoing care. Which of the following assessments has priority at this time? A. Blood pressure. B. Respiratory drive. C. Pupillary changes. D. Level of consciousness. The answer is B. Respiratory drive. 546. During a night shift, a medical doctor complains of back pain and asks the T nurse to give him morphine 5 mg IM. Which of the following actions indicates professionalism in handling the patient by the nurse? A. Call another doctor to manage. B. Refer him to emergency room. C. Administer morphine to doctor. D. Ask him to write a prescription first. The answer is B. Refer him to emergency room. 547. 3-year-old child with an elevated body temperature is administered oral aspirin. The nurse records the body temperature of the child 2 hours and finds that it is still elevated. What is the most likely underlying physiology for the delayed response in action of the aspirin? A. High gastric pH. B. Thin epidermis. C. Low muscle tone. D. Short intestines. The answer is A. High gastric pH. 548. A 65-year-old man is undergoing pre-operative preparation for an endoscopy procedure in which the physician will visualize the large and distal part of the small bowel with a camera attached to the flexible tube. Which of the following positions is the most appropriate? A. Left lateral Sims. B. Right lateral recumbent. C. Trendelenburg. D. A prone. The answer is A. Left lateral Sims. 549. A 60-year-old man is being discharged from the post-operative care unit following a transurethral resection of the prostate. The nurse provides discharge information regarding the care of the bladder catheter. Which method would be most effective in bladder retraining for this patient? A. Scheduled urination every 2 to 3 hours. B. Limit fluid intake before sleeping time. C. Perform pelvic floor exercises daily. D. Increase fluid intake during the daytime. The answer is a. Scheduled urination every 2 to 3 hours. 550. The unit nurse conducts an initial assessment and observes the dressing is wet and requires change. The patient looks drowsy with warm skin. See lab results. Blood pressure 110/70 mmHg. Heart rate 99/min. Respiratory rate 24/min. Temperature 38.8 Celsius. Test result normal values. RBC 5.5, 4.7 to 6.1 x 1012/L, male. HB 133 130 to 170 g/L, male. WBC 25.5, 4.5 to 10.5 *109/L. What is the most likely underlying diagnosis? A. Sepsis. B. Gangrenous tissue. C. Acid-base imbalance. D. Hyperthermia secondary to infection. The answer is A. Sepsis. 551. Nurse is completing the preoperative checklist for one of the patients who is wearing a ring. What is the most appropriate action? A. Give ring to security office. B. Lock ring with patient's valuables. C. Call patient's family to give them the ring. D. Respect patient's choice and leave ring on patient's finger. The answer is B. Lock ring with patient's valuables. 552. A 17-year-old woman went to the emergency department complaining of fever, sore throat, and hoarseness of voice. Laboratory tests were done. See lab results. Which of the following would be the possible complication for the patient condition? A. Cellulitis. B. Bacterial cholangitis. C. Infective endocarditis. D. Rheumatic heart disease. The answer is D. Rheumatic heart disease. 553. A postoperative patient has on order to discontinue the Foley at 11:30 a.m. The nurse removes the Foley intact. At 1 p.m., the patient complains of feeling the need to urinate and voids 30 cubic centimeters. The nurse should assess the patient for signs of which the following: A. Urinary retention. B. Urinary tract infection. C. Cystitis. D. Hematuria. The answer is A. Urinary retention. 554. A 3-year-old child is admitted to the medical ward for vomiting and dehydration. The nurse sat with the parents to comply admission interview and wanted to get as much information. Which of the following communication techniques should the nurse use? A. Use of question containing the word how. B. Use of question with direct comments to clarify. C. Use of statements that indicate patient will be fine. D. Use of leading question and those involving yes or no. The answer is A. Use of question containing the word how. 555. An ICU nurse reviews the chart of a 47-year-old man patient mechanical ventilator for a long time. Arterial blood gas result. See lab results. What condition the patient is experiencing presently? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The answer is D. Respiratory alkalosis. 556. To decrease the anxiety of a 10-year-old girl who is undergoing surgery. Which of the following should the nurse do? A. Use a heart model to show her how the surgery will go. B. Provide her with a verbal explanation of the upcoming surgery. C. Give her a book to read about the surgery 2 weeks prior. D. Let her parents talk to her about the importance of having surgery. The answer is A. Use a heart model to show her how the surgery will go. 557. A patient who is admitted denies any medication allergies. Medical records state, no known drug allergies. A prescription was sent to the pharmacy for gentamicin. The pharmacist recorded in the pharmacy an allergy to the medication. Which of the following is the best way for the nurse to do? A. Administer the medication with Benadryl, diphenhydramine. B. Notify the doctor of the allergy and request new orders. C. Investigate further, then call the doctor for clarification. D. Give the medication as ordered by the physician. The answer is B. Notify the doctor of the allergy and request new orders. 558. An 81-year-old bedridden patient in the geriatric ward was given antipyretic through his nasogastric tube. After an hour, the patient deep sleep, his breathing pattern changed and he did not recall his name. Which of the following should be the immediate nursing intervention? A. Call the physician to examine the patient. B. Check for the correct dosage given. C. Check vitals and inform the physician. D. Try to wake up the patient. The answer is C. Check vitals and inform physician. 559. At the beginning of the afternoon shifts in the receiving handover from a morning shift nurse post-coronary angioplasty. The nurse sees a waveform on the monitor, and upon assessment of the carotid pulse. What should be the most appropriate next action? A. Give a DC shock. B. Refuse to receive patient. C. Check ventilator settings. D. Shout for help and start chest compression. The answer is D. Shout for help and start chest compression. 560. After activating the emergency call system, what should be the next immediate action? A. Initiate ventricular pacing. B. Administer a bolus of lidocaine as prescribed. C. Defibrillate the patient. D. Open the patient's airway. The answer is C. Defibrillate the patient.